sometimes doctors tell you you need to do stuff, and then you're like, yeah, maybe I don't really need to do that. Maybe I'll wait just because maybe it's not that bad. Maybe I don't feel that ache anymore or whatever the problem is. And so you just let it go. We aim to solve that problem and really give our patients more control into getting on our schedule.
Welcome to Unjargoned, a podcast about healthcare workflows that make sense. We talk to people on the front lines of healthcare and explore cool workflows they're using to solve real problems. I'm Angie, product leader at Luma Health. I started my first big girl job ever at Luma almost 10 years ago. My team owns all things patient access, how to get patients through the front door.
Hey, everybody, I'm Dave Smith. I lead revenue for Luma. I am entering my 6th year. I got the strong desire to try to make a difference. Being type 1 diabetic, I see the lens of healthcare and workflows very uniquely. Oftentimes, we've got wonderful, bright folks that make great software. We have folks that want that software, and connecting those is usually found somewhere between a workflow. And I just love hosting this opportunity to get leaders in who can demystify or make simple or bring new ideas, because ultimately we're all patients. So thanks everybody for listening.
And today we're joined by Eric Gasser, VP of Information Systems and CIO at Wooster Community Hospital Health System. With more than 2 decades of bridging clinical care and health IT, under his leadership, Wooster became the first hospital in Ohio approved by the State Board of Pharmacy for CPOE, a huge milestone in digital transformation. He's also the mind behind the Fun Time Initiative, which reduced nurses' documentation burden by nearly 1,600 hours every year. Eric's blend of clinical insight and tech innovation make him the perfect guest to talk about what it really takes to make healthcare work smarter, not harder. And it's wanting to make the patient experience and access easier. This episode's for you. Eric, anything to add to that?
Oh, it's a pretty good summary. And I had a lot of help along the way. It wasn't just me. So need to say that.
Well, you've been at Wooster Community for almost 20 years. Could you tell us about what drew you to healthcare in the first place, specifically to a regional hospital?
Went to school, my college, to be a registered nurse. I actually started to be a pharmacist and figured out quickly that I did not like chemistry as much as that was required for that. So I pivoted to nursing and I got my license as a registered nurse. And I like to make people happy. I like to take care of people. And I thought I would be a clinical bedside type nurse my whole career. But in the course of my early days of my career, I discovered nursing informatics. And I have a little bit of a knack for computers. Not that I had any formal training, but I really just fell in love with that field of informatics. And I got a little taste of it in prior roles and really felt I really want to do this for the rest of my career. And Worcester Hospital had an opening back in 2006 for a clinical systems analyst. I got the job. My first role was to implement CPOE, computerized physician order entry here. At that time, we were all paper-based, and we were able to move from that to an electronic world. I love being the bridge between the computer or the software and the end user and solving the problems that they have, and be able to go back to the software and make tweaks or changes, either by working with the software company themselves or by the tools that you can get your hands on as an analyst and make changes. And there's no better satisfaction to me than be able to go to the end user, a nurse or a doctor, and say, look what we were able to do for you. Them giving me that satisfaction back, thank you, you've made my life so much easier. So that's really where I got my enjoyment. However, in the course of my career, there's other things that you get asked to do, and some of us are better at saying no than others, and I'm not good at saying no. So if there's a problem presented to me and it's not even something that I'm responsible for, I like to get involved. I like to participate in committees, and I did that at Wooster. And I got exposed to more people here. I got opportunities to show that I maybe had ability to help solve problems. And through that, I was given additional responsibilities as supervisor of applications. And then I was made the manager of the department, director, and then sitting in the chair as the vice president, chief information officer.
Eric, I would love to hear, just zooming back into that little segment where you're a nurse, you're feeling this calling, this self-propelled mission, and then why informatics? What about that puzzle did you say to yourself, hey, there's more meaning here, maybe for me. So go backwards and kind of zoom
Yeah.
in there for just a second.
Yeah, I was actually working at a nursing home. Was placed there as a quality assurance director and an education coordinator, sort of a administrative role. And the plan was that I would one day be the nursing home administrator. That was the thought process.
Mm,
And there was no nursing home to my knowledge at the time that had electronic charting in Ohio, where they did documentation of medication administration, electronic documentation, medication administration. There was some places that did some EMRs, but it wasn't very robust at the time. And one of the challenges of any healthcare institution is, to get the most revenue you can, getting paid for what you are owed. And the nursing home in particular, nurses' aides really have to capture what they're doing to take care of a patient. They call that activities of daily living, like bathing a person, dressing them, walking them, basic stuff. But the more you capture in that, the better you can get paid for the work that you do. And so I was asked to kind of be part of a team that evaluated EMR systems that are out there and was part of that selection committee. And I could just see very quickly that I could tell how that system worked, maybe better than some of the other people were.
mm,
They were explaining to me, this is how you set this thing up. So I grew quickly in that understanding. And I just really fell in love with that because, you talk to the nurses' aides and they're doing all this hard work. How can we make this system so easy for you to be able to document this, that we can capture it? While also the nursing team, we wanted to move them to electronic medication administration. No nursing home had ever done that. And Ohio is unique because the Ohio Board of Pharmacy has a rule that we're the only state in Ohio that has this rule where you have to have positive identification at the time of documenting your medication administrations or ordering medications electronically. So it was through that whole process that really I discovered that it came easy to me, but I also
hmm
discovered a satisfaction in helping our clinicians do their work easier. And that was my first exposure to the Ohio Board of Pharmacy. And we were the first nursing home in Ohio to get approved by the Ohio Board of Pharmacy. And I took that experience to Wooster when we implemented CPOE. So I don't know if that answers your question, but
Yeah.
it's kind of a balance.
Why do you think you have stayed at Worcester so long when somebody obviously with a skill set of being able to understand the delivery of healthcare from a provider lens, obviously understand the community that you're in, and you've got a bunch of giants, that are all around you. What has kept you at Worcester, and tell us a little bit about that and maybe perhaps how you have led and mentored others to understand that these workflows are really where the magic is made.
Yeah. Well, we have a great organization. First of all, I was born at this hospital. So literally one floor
Really?
below me, I was born.
Wow.
I was born on the first floor. I work on the second floor, and I hope not to die on the third floor or the fourth floor for that matter. But I was been here, I was born here. This community of, we call it Wayne County is where we live in Ohio. There's 88 counties. That's one of the main, one of the 88 counties. We're between Cleveland and Columbus. I love our community. I love Wooster. We don't live personally in Wooster. We live in the Doylestown area, which is about 20 minutes away. But to me, it's different here, and I want to make a difference in my community. Obviously, I'm treated very well. We have great leadership here. Our former CIO or CEO just retired, Bill Sharon, after 25 plus years of leading our organization. He came in a very challenging time, turned this hospital around. We're debt free. We make very good financial decisions. Patient quality is at the top of everything we do.
Mhm.
So if you guys ever come to visit here, and you're always welcome to come and visit, you'll see that we put our money where the patients are, and we don't put our
Yeah.
money where I sit. In other words, I'm in the 50s building, the original building of the hospital. The original floor in the hallway is still there. Our boardroom is folding tables pushed together. We take
Love
the
this.
money and we put it where our patients are.
That's
Mhm.
It's
so
not
great.
Mahogany Hall here, Mahogany Alley. It's that's our culture. We treat people the way we want to be treated. It's a tremendous responsibility for me to take the asset that I was given or the opportunity that I was given and take it to where then whenever I retire to the next person to carry it on. We're fiercely independent, and we want to remain that way. It's incredibly challenging right now with
Mhm.
the way finances are. But, from our board of directors to our administrative team, all the way down to our caregivers. And nothing is more apparent than when you're actually needing care. My mom had a heart issue a couple weeks ago. She wasn't feeling well, kind of lightheaded. She came to our emergency room and her heart rate was in the 30s.
Wow.
So they did an EKG and some studies, and they're like, you have third-degree heart block. So basically, the electrical communication of the heart wasn't getting through from the atrium to the ventricles. And so she wasn't getting that, the good heart rate that she needed. So they admitted her and they said, you need a pacemaker. Well, this was on a Saturday. We do our pacemakers on Mondays. You got to have the vendor here and all kinds of stuff. So we'll just keep an eye on you over the weekend and then we'll do it on Monday. On Sunday, her heart rate dropped to 19. And then she had a period of time where she had no heart rate at all, no electrical heart rate for 7 seconds. She was still talking to my dad when this happened, but they came running under a room and they had to put a temporary pacemaker in until Monday. So anyway, as a son of my, sitting there, coming in, talking to my mom, but seeing the care that's being given here really reminds me of why we're here. It's not because of what I do. What I do has some importance, but it's because of the people that are actually delivering the care. And you could see it. The doctors that took care of my mom, the nurses that took care of my mom, and the others that were involved, the cath lab. It was a good motivation to me to remind me that we have such a great place here. Like if this hospital didn't exist, my mom would have been transferred 30 minutes away. So what we do does matter. And, being able to be close for our community does matter as well. So my goal in your mentorship is to be able to have people in place that can step into my role, that I can help them be prepared to do that and take this on to the next generation.
That's so great. Such a great story. It's like a perfect time, really, to transition to just understanding a little bit about order management. I mean, it's almost, you're kind of the godfather of it. I mean, you spied this out in 2006. You built a whole set of business processes. Technology has now enabled some of this.
I feel like I am a little bit new to this game and meeting you, Eric. So I'd love to hear all about how you guys utilize like Queue Manager and how you do order management and how that helps patients like your mom every day.
Yeah, exactly.
Yeah. So in 2024, I got asked to help lead a DMAIC process. It's a Lean Six Sigma process, basically designed to look at a process that is broken or not optimized the way we want it, and to figure out where the issues are. Measure, how we're doing things now, analyze the workflow, come up with some solutions, and then see how they're working. And the workflow that we were particularly involved in for this, I think what you're asking for, the order management piece, had to do with our ambulatory physicians. So the physicians that are part of our physician groups, they place their orders in Meditech ambulatory. And our focus was on those orders that are scheduled. So those things that, we need to get you on the schedule. We know you're going to be coming for this, but we need to get you on the schedule. So we were looking from the workflow from the time the order was entered all the way through the process of getting on the schedule, checking your insurance, make sure we're going to get paid, checking medical necessity, prior authorizations, sending you an appointment reminder, having the test, and then the results going back to the provider. So from order entry to the results going back in the provider. We had gaps in that whole process and certain things failing. So that's the process we set out to do. We met as a group. So there's probably 15 of us leaders. I was the only C-suite as part of this group. There were other directors involved that were very much, a part of this, coming up with the process and solution. I'm fortunate to get to tell the story. But basically what we looked at is that whole process, and we found issues in our workflow that we needed to improve. Part of those were like education. We had the ability to do some things, but people weren't educated on that. There was some processes with, let's say, an order's placed for a patient to have an MRI, but maybe they live 45 minutes away from here and they'd rather have that MRI closer to where they lived. There was a process to close those orders out so they didn't linger in our system and look like they still needed to be done. There's issues with getting approved by insurance companies. There's medical necessity checking. Did the doctor actually order a test that meets medical necessity, or is there a better test? Sometimes our patients would show up for their appointment and they would get here and we'd say, I'm sorry, but this didn't meet medical necessity. We can still do this for you, but you'll have to pay full price for that. Are you okay with that? And nobody says yes to that. So we wanted to get that all taken care of on the front end so that when you got here as a patient, you knew, what your insurance was going to cover, how much you would owe, and there would be no sending you back home type of things. Where Luma came into this is that our schedulers would call patients to get them on the schedule. And if somebody called any of us right now to schedule us for an appointment, none of us would answer the call because we're doing this podcast.
Yep.
So then that call goes to our voicemail and we call back when it's convenient for us. Maybe it's after hours. Maybe it's a time when the schedulers are at lunch and there's only one scheduler that can answer the phone and she's on with somebody else. And so you are told you're third in line. So you're like, I'm just going to call back later. And you hang up and then you forget about it till Monday. And then you call back, it's this back and forth. And we could see in our data that we were losing out on getting patients onto our schedule. It's a revenue cycle, a revenue opportunity for us.
Yeah.
Plus, sometimes doctors tell you you need to do stuff. And then you're like, yeah, maybe I don't really need to do that. Maybe I'll wait just because maybe it's not that bad. Maybe I don't feel that ache anymore or whatever the problem is. And so you just let it go. We aim to solve that problem and really give our patients more control into getting on our schedule. So in working with Luma and talking to Kyle Hart, our salesman, who I've developed a really good relationship with over the past couple of years, basically meeting him at Meditech live event and me learning about Luma and me telling him, yeah, we're not going to need you guys. We already have something in place for that. But it's nice to meet you, to actually purchasing several solutions from you guys since. So kudos to Kyle and your team for really bringing the solutions that we needed. Where Luma came in for this process, though, is now when that test is ordered that needs to be scheduled, our team vets it. We make sure the doctor ordered the right thing. We make sure that it passes medical necessity. Once it, check the insurance, those types of things. Once it does all that, we're ready to schedule. And that happens fast. We mark that patient as ready to schedule in Meditech. Once they're at a status of ready to schedule, then Luma reaches out to the patient on our behalf. When this is fully implemented, and we're not completely done yet, we have parts of this live. When this is fully implemented, a patient's going to get a text or an email from us saying, Dave, we're ready to schedule your MRI. Your doctor, Dave, ordered this MRI at Wooster Hospital. We're ready to schedule this. Here's 3 options for you, Dave. Click here to call our schedulers.
Yep.
Click here to chat with our schedulers. Or Dave, if you'd like to, just click the link here and you can schedule at a time and a date that's for you. So 3 options. Some people don't want to self-schedule. There are still people like that. But the vast majority of us, I would argue, and will continue to grow, want control of this transaction. And our goal is to give them that control to be able to do that. So that's what we're setting out to do and have set out to do with you guys.
I love that. Like, even as a patient, like, I can't imagine what that's like. I never answer the phone. It's on Do Not Disturb 24/7. Only my husband can get through. And even like, I've gone to my PCP year over year. I'm wildly overdue for a blood test. Have I done it? Embarrassingly, no. But I feel like if I were to get these texts knowing that like my provider actually cares and like wants the best for me too, and like is helping me in every way that they can to get this scheduled, like I can't even imagine what that experience is like. Like, should I move to Wooster County? I don't know. But I feel like that's how I'm feeling right now. And Eric, like with your team, like with everyone working out of this workflow day to day without Luma or without any automations, like are they excited for these changes? What is their experience like now, or what are they looking forward to?
Oh, absolutely. They're excited about it because, one, it's less manual work on our team's behalf. We're growing, like we're adding more physician practices. And so the volume of having to reach out to patients and call, that is only going to grow. So Luma is going to help us with doing a lot of that work for us on our behalf. Now, there's still going to be a need for schedulers to talk to patients and do their job, but being able to lessen some of that burden, to me, it's a win-win because for the doctor, you get the patient in quickly. For the patient, you give them more control over how they want to get on our schedule, and there's more coming with stuff we're doing with you guys. And for us, we keep our schedules full. We're getting people on our schedules and then tying that in with the appointment reminder solution that we already have in place with you guys, tied in with our your rescheduling functionality and waitlist functionality, where if a patient cancels, then we say, hey, are you sure you don't want to reschedule? So hopefully we don't lose you. We get you to reschedule. But if they do cancel, then people that are on our wait list are going to get a call or a text and say, hey, would you like to be moved up, your appointment to be moved up earlier? And who doesn't want to be seen earlier? If it's something especially that you're anxious about. And that's all automated. That takes the human out of the loop, and that keeps from a revenue cycle standpoint, that keeps our schedules full. So it's a win-win.
Yeah.
Eric, how do you, just real quick on that new workflow for the community, how do you plan to educate the community that you've implemented this for really their benefit? Do you expect it to be just word of mouth? Are you doing any push education, any marketing, just so that folks really know that you've invested all of this for them?
Yeah. So we learned from this. We turned this on. We're excited. We're gung ho. And we didn't really see initially the results that we thought we would see as far as patients. When we first turned it on, it was really click to call. It wasn't, the self-scheduling thing wasn't on yet. And we really didn't see the increase that we thought we would see in scheduled appointments. Well, we learned that we didn't really educate our patients at all. We just turned it on and we thought it would just work. And to your point, our marketing team has developed handouts that explain this. You are going to get a text from the hospital for this purpose. This is to benefit you. It's a safe link to click on. Here's the number it's going to come from. And that is being put into the hands of our physicians' offices. So as they are ordering these tests, they can give them to the patients right then and there and explain that they know to expect this from us. But it was a learning experience because a lot of us are trained, don't trust things that come in that you're not expecting. And I think we saw that initially.
Oh, that's such a great example. What do you think is next? What's on? I mean, I've known you now not as long as Kyle, but I know a year and a half ago your whiteboard looked differently. What are you trying to tackle now that's relatable to this combination of patient experience, operational efficiency, and economic win for the Wooster?
But what I'm passionate about right now, and it has always been this way, but being able to break down any barriers for patients to come to our hospital or for providers to send their patients to our hospital. Providers have choices and they can steer patients in different directions. Obviously, the patient has the choice of wherever they want to go. It's their healthcare. But providers have some say and control in how they educate patients on, where might be the best place to have something done. I want it to be as easy as possible for our providers to be able to access care here for their patients. So if they want to order something here at our hospital, we don't make them go through hoops to do that. And when they do order it, they're going to get their results back in their EMR because not everybody that orders is one of our providers. We want anybody in our community to have that free access or, no barrier to come here. That's part of my passion. The other passion is for our patients. We want them to be able to access care at the hospital with as few barriers as possible. Healthcare is so complicated. The payment process really messes all this up. Like to me, it's so easy to go onto Amazon and order something, one-click ordering, or it's so easy to go book a flight or book a hotel. And I want that for healthcare, but the insurance pieces, the prior authorization, the medical necessity, do you have the right diagnosis code? Do you have the right order? That all gets in the way. I don't have many quotes, but my one quote for this whole thing is, if we didn't have to get paid, this would be easy, but we have to get paid. So trying to tie all that together and make it seamless for our patients is really what I want to accomplish in this. I don't want them to have to put a password in to schedule something, etc. So as you say, where are we going? It's this patient access journey. We continue to work with you guys on the next phase of this, which is check-in. So getting, we're building a new patient access and emergency center. It's going to open up on February 25th, 2026. When our patients come into our building, if we know that you're coming, if you're on our schedule, they're going to get a text ahead of time where they can pre-register, fill out and sign forms. Then when they show up, there'll be a kiosk. They can let us know that they're here, and the goal is that any copays that would get paid, and then they're on their way, removing those barriers, getting to where they need to go as quickly as possible. For those patients that we don't know are coming, we don't schedule tests today. We don't schedule x-rays. Those patients walk over. They might bring their order with them from their doctor's office, or their doctor might have sent it over here, but they show up. We want them to be able to go up to these kiosks, get in a queue to let us know they're here, why they're here, and then we will bring them up and talk to the registration staff and get them in and get their test or service done as quickly as possible and get them on their way. So those are the things we're working on to try to improve access and remove barriers that are out there.
It's really a wonderful North Star for the next 6-12 months.
I feel like with your health system, this whole platform story really makes sense. Like your CVS list receipt of all these things that you could tackle next, I'm sure it goes on forever. Even if you've handled order management now, Dave touched on what's next, but that what next probably changes all the time and probably grows all the time as well. And so I'm just really excited for this partnership with you. We have things like faxing and like how we can start the workflow earlier than when it comes to the order creation. Like we deal with this all the time. So I'm just really excited for this long-term partnership with you.
Yeah, I think this business relationships are very important. I've gotten to know a lot of vendors, partners over the years, and I really consider them to be my friends. You spend a lot of time with people, either through virtual meetings or at conferences and things like that. And relationships do matter. You learn who you can trust, and I'm excited to be able to partner with you guys and work with you guys. And the team has been really, really good to work with so far. And I have no doubt that will continue.
Eric, one last question for you, just around the community that obviously you're a leader in with Meditech and Muse. What advice would you give to some of the regional health systems that are fiercely independent, that have Goliath in their geography somewhere, but still feel the same exact DNA to serve as the backbone, in some cases be the largest employer, but also where babies are born and where people go to get better and that last phase of life? What would you share with them if they came to you and they said, hey, we want to attack patient experience, patient engagement, create patient success, but we don't really know where to start and what we should tackle? How would you advise them?
That's a good question. One thing I would do is talk to your patients and see what their pain points are. It's always good to talk to the people that you're taking care of and get their perspective, or talk to your staff. We have 2 years for a reason, and to me, that's the starting place. The other place is to gather data. You really only can assume how you're doing without the data. Without data, you're really kind of blind. And so gathering that data, one of the simple things that everybody does now is appointment reminders. But how important are those to keeping your slots filled? How are you doing with what solution that you have in place currently? Do you know that number? And is that where you want to be? I mean, just starting, in my opinion, you just start to pick areas that you think would make a difference and start getting data and see where you're at. And if it's good, then move to the next thing. The other thing is just, don't let perfect get in the way of what you're trying to accomplish, because like I said, this is not the easiest processes in the world that we're talking about with patient access. And if we waited until everything was perfect before we started, we wouldn't have started yet. And you guys have heard the term fail fast. Like, let's try it. And if it's not going to work, then we'll do something different. But that's kind of our mantra here, is to start it, figure it out. If we're good, keep going. If it needs to be tweaked, tweak it. But if it's not working, okay, we tried it. This is why it didn't work, and we're going to go try something else. And I'd just say the other piece of advice is to network. Like, I was always the shy guy growing up. Like, I would rather just stand in a corner and not talk. And through my career, I had to force myself to overcome that shyness. And I used to go to conferences when I first started, and I didn't know anybody. And I would see other people that had been around for a while, and they would visit vendors and they would be talking to other CIOs, and they looked like they knew everybody in the building. Like, that's never going to be for me, because, I just felt like I'd never would get to that point. But I forced myself to start talking and networking. And I value so much the networks that I have with vendors and with others that are trying to do the same thing that I'm doing. So getting yourself out there and sharing your problems and pain points and solutions with each other, we help each other. And that would be another piece of advice I would share.
One last follow-up question for you to give context on is, let's say somebody takes all that advice and they go do this, but they don't know how to go and represent the economics of doing these things. What would you share would be maybe if you picked 3 economic metrics that will be better, but they had to go and they had to talk to their board or fiduciary folks that need to make this decision, maybe the CEO. What would you tell them? These 3 metrics.
I would say number 1 would be the percentage of your appointment slots that are filled. Every patient that is in a slot that's not empty is going to be revenue. I would say another one is your satisfaction of your patients. They have a choice of where they go. You mentioned the behemoths of other health systems in our community. We have great healthcare in Northeast Ohio, and I'm not ashamed to say that. Even, we are a great healthcare system, but there are bigger healthcare systems in here. So being able to provide a service that makes our patients happy is going to keep them coming back. If it's so hard to come here, or the service they get or the quality of care they get is bad, they'll go elsewhere. So patient satisfaction is another metric, which we use your product, the feedback module, to help measure that, along with Press-Ganey to tie into that. You said 3. Let me think about that. I would say maybe provider satisfaction would be another thing as well. Like I said, nurses have a choice of where they send their patients. So making sure that they're happy with the care and the ability to get their patients in here and the results back to them satisfactory is another measure. I'm sure there are more, Dave.
Yeah, that's
think about that one.
Quick question. Sorry to close us out before we do rapid fire. Eric, how do you manage those relationships with the providers that are in your network of getting the orders in and referring patients in and out?
Yeah.
Does somebody go out and talk to them, or what does that look like today?
We do. We have a provider liaison, a community provider liaison that is managing those relationships. And she is kind of the go-between between them and the hospital. She's listening to them, telling them the things that we're trying to do to help them, listening to any feedback that they give and bringing that in, making sure that we're all striving to take care of the patients in our community. Our goal is our patients can get health care locally here. They don't have to go elsewhere. So yes, that's important. And Dave, the metric that I forgot to mention that came to me is the percentage of our orders that are scheduled to completion. So metric before we introduced this, over 30% of our orders were not getting completed. They either weren't getting on our schedule, they were going somewhere else or getting canceled. Our goal is to get that number down below 10%. So we are making good progress on that. But clearly that would be a reason to show an ROI.
Oh my gosh. Yeah. Angie, I know we're running up on time, Eric, but as a follow along, Angie and I have spent so much time looking at that flywheel of when providers that refer in for care and how hard that is and why it's just not kind of what you said. If things were so easy, it would just be made better. It's really hard, whether you're talking about pre-appointment testing, whether you're talking about getting, the information, which isn't a fax, but there are so many reasons why this is really hard. And that's exciting, because I think technology will make an impact there.
Absolutely. No doubt about it.
And Angie leads all of our products for that.
I know, which is why I'm surprised it's my first time talking to you, Eric. But that's okay. I will be your friend going forward. Jumping into rapid fire. Anything else you want to add? Final words, Eric, before we jump into some fun questions?
I don't think so. Well, thank you for having me on. I appreciate it.
Of course. Okay, first things first. If someone were to visit you at Wooster or where you live, where's the first place you'd bring them?
I actually probably take them to my house and have dinner at my home with them.
What would you cook? What would you cook?
I would probably make grilled pork loin sandwiches that my father-in-law taught me how to cook those, not without overcooking them, and that's something we have all the time.
You're going to have half of Luma that's going to come visit you.
Hey, anytime.
And I guess if the Wooster Community Health Team had a mascot, what would it be?
That's a good question. I said a golden doodle, only this is a little bit because I sell miniature golden doodles, and I think that they're like the perfect dog. It's the golden retriever who's so friendly and playful, with the poodle that doesn't shed, but in a smaller form factor. That's kind of feels like Wooster,
A great family dog.
Right.
That's awesome.
Yeah.
And then if you had a magic wand, you could fix one EHR quirk forever. What would it be?
Tell you what, it's hard to come up with one. But if I stick with one thing that bugs me right now is that there are so many, patient portals out there. We have our own, all the other systems have their own. If we could have one portal for every patient that they could access all their information in one spot
Everything.
without having to have all these different logins, that's better for everybody's individual patient care.
Well, that's it from
Preach.
me on Rapid. Yeah, we feel all that all the time. My goodness.
Yeah.
Yeah.
Well, Eric, thank you so much for gifting the community your knowledge and your time. And you're a inspiration, and obviously how you've built your career and how you impact the community and your own personal North Star. It's really, really wonderful. And so I compliment you. I compliment Wooster. We look forward to having you on down the road where you can talk more about the impact and probably what comes next. I mean, I think again for our listeners out there, we always try to connect you to these big brains and kind people. And Eric, thank you so much. So on behalf of all of us, we appreciate you.
Thank you, Dave. And thank you, Angie. Thanks for having me on. I really appreciate spending a few minutes with you guys today.
You bet.
Thanks so
Great.
much. And we'll be over for pork loin sandwiches ASAP.
All right. Sounds good. See you. See you
Thanks,
then.
Eric.
Okay.